Hello, and thank you for listening to my presentation. My name is Gina Johnson, and I am a chemical health prevention specialist with the Youth Service Bureau. We are a nonprofit in Washington County. Today's topic is going to be about substance use disorders. An objective of mine is for you to know how serious an addiction can be, but to also know that this is not about shaming anyone. First, I'll talk about the different substances that there are, what a substance use disorder is, and how we can prevent one. First things first, what is a drug? I'm only going to be talking about drugs used for recreational purposes, nothing that is considered a medication. I also want to clarify that I will be using the term drug and substances interchangeably. The Drug Enforcement Agency, also known as the DEA, recognizes 5 classifications of drugs. I will be focusing on the 3 most commonly abused by adolescents, and we know that they're the 3 most popular because of the Minnesota Student Survey. So, a depressant example would be alcohol or Xanax. Stimulant would be caffeine, cocaine, nicotine, or meth. A hallucinogen would be PCP, mushrooms, or LSD. Opiate would be heroin. And the 5th category would be an anabolic steroid, which is testosterone. Alcohol is a depressant which slows down our central nervous system. It reduces our brain's activity and awareness. There are many adults that can use alcohol in a low-risk way, which would be about 1 to 2 standard drinks in a sitting, because our bodies can metabolize 1 drink an hour. However, teens do not consume alcohol this way usually. Teens have a different sensitivity and tolerance to alcohol because your brains are still developing. So, when you do drink, you tend to binge drink, which is 3 or more alcoholic drinks for females within 2 hours and 4 or more for males within 2 hours. So the point of that is to get drunk. So, binge drinking leads to risky behavior such as impaired driving, unprotected sex, blackouts, or alcohol poisoning. And to know that alcohol and tobacco are the 2 of the leading causes of preventable death in the world. Alcohol kills 88,000 people a year. Marijuana is classified as a hallucinogen, but can also be considered a stimulant or depressant depending on how you use it. THC is the mind-altering component found in marijuana. It's the drug that gets you high, not to be mistaken for CBD, which is also found in marijuana, but it does not get you high. I often hear that using marijuana does not lead to an addiction, and that's far from the truth. 1 in 6 youth who try marijuana will become addicted. Using marijuana leads to a decrease in reaction time, memory, and you have a harder time with problem solving. When using high potency THC, known as dabbing, this can cause psychosis, delusions, and may lead to an emergency room visit. Nicotine is the drug found in tobacco plants. It is a stimulant increasing our central nervous system, leading to a rapid heartbeat. It is extremely addictive. It's actually the top 3 most addicting drugs in the world and can cause changes in our brain chemistry. Traditional cigarettes, like I said earlier, was the number 1 most preventable cause of death, and that kills almost 500,000 people a year. According to the Minnesota Students Survey, vaping is the number one way young people are getting nicotine. It's important to know that the nicotine in vape devices is usually much higher than traditional cigarettes. Sometimes it's even double or triple the amount of nicotine. And if you get too much nicotine, which is called nic sick, it can cause you to vomit, become lightheaded, collapse, or get dizzy. This means you are overdosing on the drug nicotine. It is a poison after all. It's a very scary feeling to experience nic sick. Some have reported they thought they were even dying. One of the primary reasons underage substance use is taken so seriously, and why I come in and talk about it, is because our brains are not fully developed until we are 25 years or older. The last part of the brain to develop is the prefrontal cortex, known as the CEO of the brain. And our brains actually develop from the back to the front, meaning the prefrontal cortex is at the front of our brain. The prefrontal cortex is in charge of decision making, goal setting, and regulating emotions. It's also known as the brakes of the brain. It's telling you whether this is a good decision or a bad decision. Our brains are also going through a pruning process during middle and high school. It's getting rid of habits and skills in our brain we no longer need and strengthening the ones we do use and need. So, if you start using drugs during this time, it causes these skills to be remembered, and that can lead to continued use of drugs. So, what you choose to do right now is personalizing your brain for adulthood. Now, after hearing a little bit about our brains and how they develop, what do you think the number one predictor for addiction is? If you guessed age of first use, you would be correct. The younger we start using, the more likely we are to develop an addiction and the quicker it will develop, regardless of the substance. A fact that I often like to share is 90% of smokers started before the age of 18, and 99% of them started before the age of 25. And the brain development also has to do with the legal age. So the reason why alcohol, the legal age is 21, tobacco purchase is 21, and if marijuana becomes legal, it will be 21, is all because of our brains. All right. What might be some consequences to using substances illegally or underage? You're more likely to become truant or drop out of school. An OWI, or operating while under the influence, is a legal crime. You know it's illegal to drink and drive, but did you also know it's illegal and dangerous to drive while high? And this goes for cars, boats, lawnmowers, anything that you can drive. And not on here is a felony. Do you know what a felony is? Currently, you could be cited with a felony for having THC concentrates on you. A felony is not going to go away when you turn 18. It's a very serious crime and can jeopardize employment, scholarship opportunities, college applications, and even housing later on in your life. Pretty big deal. But another piece to talk about is the Good Samaritan, or Steve's Law. It's a law that could help you save a life. Let's say you're at a party and you've been drinking or doing something else illegal. All of a sudden, one of your friends gets sick and needs medical attention. You're worried because you're maybe high or drunk, but if you call 911 or an ambulance, this law will allow you to call for help and not get in any legal trouble. You just have to stay with the person. So that's a pretty big deal and can help save somebody's life. I often hear, especially from middle school students, why would anyone want to use drugs if they know they were bad? There are many reasons, and a few are listed here. One of the reasons I'm going to talk about is misinformation. If you don't have correct or factual information, then you might not see the negatives to using. So one of my hopes is in this presentation, I only use factual information. So hopefully that can help you change your mind about using substances. Another reason or risk factor is mental health. About 60 to 80% of adolescents who are abusing substances also show signs or symptoms of a mental health disorder like depression or anxiety. It's sort of looked at like the chicken or the egg conundrum. Which came first? Are you using because you have a mental health disorder and you're coping? Or did you start using and now it's created a mental health disorder? We really don't know usually. But it's important to know that drugs do not cure anxiety, stress, or depression, or any other mental health disorder. They sometimes will numb those feelings for just a little while, but often the problem will come back worse. That's why it's important to learn healthy coping skills, which we'll talk about in just a few slides. Substance use disorder is the medical term for addiction. I'm going to go back and forth with using either addiction or substance use disorder terminology. Here's the definition of what an addiction is. It's a complex brain disorder with behavioral components. It should be treated as a medical disorder, but is often viewed as a moral failing or weakness. My hope is to change people's understandings and view it like diabetes, cancer, or heart disease. One must experience 2 or more of the 11 criteria within a 12-month period. The more criteria you meet, the more severe the disorder is. So here are 6 of the criteria, and here are the other 5 criteria. So for example, if you don't vape, you're probably not thinking about it at all. But if you do vape, you're probably thinking about it right now. You're thinking, when's the next time I can go vape? I'm going to wake up in the morning. That's all I'm going to do. I can't usually go without maybe an hour without even hitting my vape. So that's a sign of a dependence and can lead to substance use disorder. So maybe you saw on here of these 11 things, a couple things that you are starting to fall under. Pay attention to these. Now picture in your head what you think people who use drugs look like. Are you picturing this? Homeless people, a mugshot, bad teeth and bad skin, or just really skinny? Yes, sometimes it does look like this, but not always. Often I feel like this is how media portrays drug use. But it could also look like this. People who are in recovery. This picture, or all of these pictures, are celebrities, but it could also be people you look up to, people in your community, family members even. Drugs do not discriminate. And I know that's cheesy or corny to say, but it's so true. So, another point to be made is no one woke up as a teenager and said, you know what, today's the day. I'm going to become addicted and face struggles and challenges for the rest of my life. No. The initial decision to take drugs is voluntary for most, but repeated drug use can lead to brain changes that challenge a person's self control and interfere with their ability to say no. So no one plans on becoming addicted. And getting help is oftentimes hard. Do you know what stigma is? It's defined as a mark of disgrace associated with a particular circumstance, meaning some people are afraid or don't want to admit that they have a problem because of how others might look at them. We don't judge somebody for having asthma or cancer, and this really shouldn't be different. But unfortunately, it is. 1 in 7 will experience a substance related addiction in their lifetime, and only 1 in 10 of those sufferers will actually get help. And a big reason is because of the stigma around it. So let's try and help to destigmatize substance use. And now moving on to ways we can prevent drug use and addiction. Healthy coping skills are ways to deal with unpleasant emotions like stress, depression, or anxiety. We can turn to these healthy highs instead of unhealthy ones. Here's a short list of a couple different ideas for coping skills. A few of my favorite would be yoga, walking, running. I also really enjoy journaling, talking about the feelings that I'm experiencing. Change to Chill is also a website where you can get customized ideas to deal with stress in your life. I encourage you to go check it out and identify 5 ways to manage stress or cope with unpleasant emotions that you like. 3 Good Things is all about gratitude. Whether it's in the morning or in the evening, try and pick out 3 good things that happened to you that day or will happen to you. And they can be small things like, hey, I had a really nice lunch today. Or they can be the big things like, I am just so happy with my family or the health that I'm experiencing. They can really be anything that's positive. And when we start experiencing gratitude, it puts us in a better mood, a more positive mood. Okay, but what if a friend is using? What do I do then? All right, listen. Maybe they're going through a tough time and trying to use drugs to cope. One of the hardest steps is admitting it. Actively listen to them without judgment. And maybe you can even encourage them to use some of those other healthy coping skills you just learned. Next, encourage. Encourage them to get help as soon as possible, whether that's them talking to a family member, a school counselor, or a therapist. Share. Help them to understand how their use is not only hurting them, but also hurting you. Inform. Help them find support or resources. There are so many resources out there that you can look for. My next slide even talks about a couple of them. And support. Don't give up. Even if they aren't ready to quit, keep encouraging them. And lastly, what support is there? Each of our schools should have a chemical health clinical specialist there. You can go talk to them about, your experimentation or a family member's, or you're concerned about a friend. They are a confidential resource. If you don't have a clinical specialist, you can talk to your counselor. They're always there to listen. They might recommend a Rule 25 assessment, and that's done by a licensed clinician who will help you identify what your problem is. They might tell you you need inpatient treatment, outpatient treatment, or they might just tell you that it's just a beginning stages and help you with coping skills or therapy. My Life, My Quit is a young adult or adolescent program to help you quit your vaping or tobacco addiction. And I often hear from young people, I really want to help my parents quit their tobacco. Quit Partner Minnesota is a free resource as well for adults. Gobi.support is an online early intervention program, and Al-Anon or Alateen are anonymous groups that you can join to either talk about your struggles that you're experiencing or your struggles because somebody in your family is using drugs. Alrighty, so if you have any questions, please feel free to reach out to your teachers and they can get back to me and I will be happy to answer any questions that you have. Thank you for listening and remember, let's help to destigmatize addiction.